All right. Hello, everyone. Welcome back to the Dental Hygiene Basics podcast. My name is Dana. I am your host, and I am here with the Stephanie Bots from Steph with Polished Posture. Very excited to have you here. I know that was a little bit of a mouthful. I should have warmed up like my vocal exercises before I started. Just so happy to have you here and to share your dental hygiene origin story. So that's the question I always start with. Basically, how did you get here?
Man, how did I become a hygienist? It definitely wasn't something that was on my radar, like at all in school. But in college, I kind of got to the point where I'd gotten a lot of the core classes out of the way and like, what do I want to do? And I was on vacation with one of my sisters, and her friend was a hygienist. And so we just started talking, and she was telling me about the income potential and like the schedule. And because I was kind of thinking about nursing, kind of, but she was just like, well, if you go into hygiene, the schedule's a lot kinder and the money's just as good, if not better. So it kind of planted the seed. And I had had a lot of dental work done when I was younger because I was missing 7 and 10. So I had like ortho and expansion and implants and all of that. So I just kind of was like, well, all right. So I just went down that path and had some setbacks along the way, which we can talk about, but I kept at it. And I'm so glad that I did. It's a great profession.
Yeah, that's so exciting. Well, I have two train of thoughts, and I'm like, don't go too far down the one, but the missing 7 and 10, the laterals, wow, just a learning lesson. That's one of the most common congenitally missing teeth. Is if you're going to be born without them, those are probably the ones, or the third molar. So I'll use that as a little, learning lesson time. But beyond that, I got to know the setbacks, because that's what I want the students to hear. We all have hurdles on our journey to becoming a dental hygienist. So yeah, let's just dive right into the setbacks.
Yeah. So setback number one is I did not get in on my first try. My GPA when I tried the first time was, I think it was a 3.7. And then I got the letter in the mail and I was the second alternate and I didn't get in and I was crushed. Organic chemistry was the class that brought down my GPA. I had taken it twice up until that point. I got a C the first time, I got a B the second time. So that was the thing that was dragging down my GPA. So I took it a third time and I finally got an A. I seriously, Dana, I don't even know how I got an A. Like I think it was just straight memorization. I still don't even know what organic chemistry is. So anyway, I got in. But then the second setback was one of the instructors in my second year pulled me aside and said she was worried about me passing because my instrumentation skills were not great. That kind of lit a fire under me to stop. Me and my friend were kind of like jokesters in the class, and I was just like, okay, I need to buckle down here. Anyway, I passed. And I have to say, I think because of that, I got very good at my exploring skills, my instrumentation skills. Like I'm a very good hand scaler. So, it all worked out in the end. But yeah, I mean, we all have bumps along the way, right?
Yeah, and sometimes we need a little fire lit under us to,
Yeah.
just get where you need to be going. And you've done so many amazing things in your career since then. So I know that it all has happened for a reason, right? That's how I always
Yeah.
feel. The journey takes you where it's supposed to. Well, I love that you had to overcome a few struggles. I'm a second time girly myself, did
Oh,
not get
yeah.
in my first time. Yeah, so I totally get it. And so what did you do in that time between when you applied the first time and didn't get accepted? What did that time span look like for you?
Yeah, so I retook that class and really my class schedule was lighter at that point because I didn't really need any other classes. So I think that was the only class that I was taking. And then, I was broke. So I got a job and I worked. And then I did some shadowing at different dental offices just to like, I don't know, make sure that this was something I wanted to do. Back then I was married at the time and we got, I think 2 dogs during that time. So, and did we buy a house? I can't remember. Yeah, I think that we bought our first house then too. So it's like got that stuff out of the way. And then I got in the second time.
Okay, awesome. Where did you end up going to dental hygiene school?
Yeah, so I was born and raised in Fairbanks, Alaska.
Wow.
Yeah, and they actually, I think they still have the hygiene program there. They didn't though at the time. So I did a lot of my undergrad in Fairbanks, but then I moved down to Anchorage, Alaska, and then that's where I got into hygiene school.
So cool. Okay, I
Yeah.
have definitely never had someone on the podcast who went to hygiene school in Alaska, so that's very exciting. So you got in, second try, got started. What do you feel like was the most difficult part while you were there?
Like technically, like the hardest skill for me to learn.
Anything at all? Some people will say like finding patients. I guess, did you have to find your own patients in Alaska?
Yeah, we
Yeah.
did.
And was it difficult?
Actually, I mean, yes, but I feel very lucky because one of our rotations, we were at one of the military bases there, and one of my patients, he needed some work, and I think I did. What did it? I think I did half of his. He needed like some serious SRP. Super nice older guy, just really, I don't know, just generous with his time, very supportive, very kind. So I did half of his mouth at the rotation, and then he volunteered actually to be my patient for the second half. And he showed up, and everything was fine. But one of my classmates, I remember her patient did not show up, and it was just kind of a nightmare for her. So, I mean, yeah, it was hard, but that probably wasn't the hardest. I would say the hardest technical skill for me to learn was calculus detection. That
Yeah.
was that like figuring out what's calculus or what's the crown margin or what's the CEJ or what's a, just a defect in the root surface. Like that was tough for me.
I can agree with that because I remember being like, I don't know if I actually know what
Yeah.
calculus feels like. And like you're cleaning the teeth, and they're coming in checking. They're like, okay, that quad's done, or you have a residual here, and you're like, I guess, I don't know.
Okay.
And the way I kinda think when you were saying that, I think, like, you have to kiss a lot of frogs, right, before you find the
Yeah.
right one. I kinda feel like you have to feel a lot of calculus before you actually know what a root surface feels like compared to calculus. So, if you're going through school right now, it's okay to have those feelings. I really think it was maybe 2 years into practice before I really felt confident. What about you?
Yeah, it's a time thing. And that's always the most frustrating answer, right? Because we ask, we want the answer now, we want to learn it right now. And for someone to say, it comes in time, like, you'll get it. It's just kinda like, okay, but it's true. I mean, you have to feel a lot of crown margins. I would say trying to get instant feedback if you can, either from one of your classmates or one of your instructors being like, "Okay, what is this? Is this a crown margin or is this calculus or what?" And just having that instant feedback so you can start to associate the different feels with what it is. Yeah, but I mean, it just takes time. Probing too, that was something I feel like I didn't master it until, I don't know, a good 2 years out of practice.
Yeah, probing was hard for me too. I remember whenever I took REB, which was our clinical exam to get your license at the end, and we had to do it on a patient, which now it's mainly mannequin based. But, that was where I lost points was on the probing.
Mm,
And I remember even some of my feedback forms are like, still needs to work on probing. I'm still working on it. It's not getting any better. And then one day you're like, I'm doing it, and you don't second guess yourself as much. But yeah, that time aspect, I don't know what it is about us in dental hygiene school that we think we should just pick it up and be able to do it. But I think of it like an athlete training for something, right? It's like you have to start from the beginning. You got to learn how to dribble and then you got to walk with the ball, then run with the ball. Like those are all difficult concepts to master when you're doing it for the first time. So I agree.
yeah.
Just time and patience and giving yourself some grace. I think sometimes we think, oh, well, the instructor is telling me I'm going to get a bad grade or they're going to, take points off if I leave calculus behind. And yes, maybe that is all true. But at the same time, there is not, I think, as high of an expectation as the students feel there is on them. At least that's what I think from like an instructor standpoint. But that's beyond the point.
Well, I think as students too, looking back, something I wish I try hard not to have regrets, but something that I wish I would have known back then is like, when you're in the program, you don't have to be perfect. We think we have to be perfect and have the 4.0 to get in, right? And maybe sometimes we do to
Yeah.
actually get into school. But I was still in that mentality the entire time I was in hygiene school, putting so much pressure on myself to get straight A's or be number one or whatever. And it's like I was already in. I didn't have to do that. And so maybe if I was putting a little bit less pressure on myself, I could have enjoyed the process a little bit more, maybe learned a little bit quicker because I wasn't worried about being so perfect all the time. So that's definitely something I wish I would have maybe let go of back then.
It's so funny to hear you say that because I think I've said that exact same phrase, and I think I even wrote an article about this, but basically just this persona of a person that you create. Like you said, you're trying to get into dental hygiene school, you're trying to be perfect, and then you don't drop it. So it just stays with you, right? Well, my problem was I also did not drop it when I left and got into clinical practice, and I really struggled in clinical practice. What about you? Did you have that kind of follow you around too?
Yeah, yeah, and it's like if I was running over on time, time management is a huge thing when you get out, or thinking that every patient has to love you, and if I was catching vibes on a patient they didn't like me, it would like destroy me. I would take that home with me, and so yeah, we put a lot of pressure on ourselves that really just is not necessary.
Yeah. So how do you let go of something like that? I know you do a lot of work. I mean, just in general, I can tell that what you put into your physical fitness, your body health, I'm sure that you think mental health too. So, do you have any advice for how to let go of some of that perfection?
I think it's taken me a long time, Dana. I'm a recovering perfectionist. I'm a recovering people pleaser. But I think the more comfortable you get, and maybe this is another time thing, I don't know. I'm 43 now. And I think something that has come with me with age is just being more comfortable with myself and accepting myself, like flaws and everything. And if someone doesn't like me, that's not a reflection of me. It doesn't mean that I'm bad. It's okay. Like, not everyone should like us, and I don't want everyone to like me, right? Like, there's some people like I don't really care if they like me or not. So I think it's just being more comfortable and confident with yourself, and yeah, just knowing it. Like, not everyone has to like you. It's okay.
And I think there's something about self-awareness that goes into that, that maybe we don't have when we're younger. Like we recognize, I don't like this feeling, but maybe you try and distract yourself or you just keep going, right? Whereas, at least for me, I feel like as I've gotten older, I've gotten more introspective, and I'm like, well, why do I feel that way? Why does it bother me so
Yeah.
much? Not from a chastising, like, why are you letting this bother you? But like, no, really, why does it bother you? And I think some of that does come with time and age and like you said, just better self-acceptance of yourself. I feel like I'm moving into that phase in my life, which is weird, coming I think it does just come with time and age, it's life is a funny, funny thing, but that's either
Well, it's too like, you know, it doesn't feel good, right? To constantly be looking to others for approval or relying on other people for your own self worth. I mean, that's a dangerous, unhealthy place to be. And honestly, I was there for a really long time. And I remember what that feels like. And I think now it's just like, I don't want to feel that way anymore. Like I'm fine with myself. I'm okay. Am I perfect? Absolutely not. I make mistakes every day, but that's okay. But I don't want to put my own self-worth in the hands of someone else or the amount of likes I get on social media or whatever, it's like we're so much more than that, but it's definitely an inside job to kind of, I don't know, develop that comfort with ourselves. But I just always will remember how crappy it felt and I don't want to go back there.
Yes, yeah. And I that's something that I struggled with too. And I still do. It's something that we're always a work in progress. You have to keep working
Yeah.
on it. And that's what I've talked about with some other people on the show before. I'm like, we're all doing the things that we're doing, in the op, outside the op, after you graduate, all the big scary things. Like we're still doing it scared, we're just
Yeah.
figuring out as we go along. So I know what you're up to now, but I would love to know your career progression. Like you graduate, what did life look like from graduation up until now?
Yes, I worked in a ton of different offices, which I wasn't anticipating, but I was looking for, the office that fit my vibe, my personality. I like to have fun, and also a place where I can grow and that has the same philosophy with patient care that I did. And it took a while. So I worked for a few offices up in Anchorage. I lived there for about a year after I graduated. And then me and my now ex husband moved down to Denver, but still working in a lot of different offices, both private practice and corporate offices. But then I finally found what I would say was my unicorn office at the time. I was there for almost 10 years here in Denver, but I had worked in I don't even know how many offices up until that point, which I thought was a bad thing at the time, but I don't think it is. You get exposed to a lot of different people, a lot of different ways of practicing, find out what you like, what you don't like. And then it just makes you really appreciate that one office when you finally find it. So I was a full-time hygienist for about 13 years. And then that's when about 5 years ago, that's when I started my business, Polished Posture. And then I went part-time hygiene. And now I'm basically on a fill-in basis when I can.
Yeah, that's awesome. So what motivated you to start Polished Posture?
Yeah, it was my own body issues. I was trying to figure out why I was in so much pain. I had a low back problem and it just wasn't sustainable. And I was like, I cannot do this. Like, I feel like I'm 80 years old. I'm in pain all the time. So I started making these small little tweaks with my ergonomics, learning equipment that I should invest in, things that actually like fit me and my body, like stools and loops and stuff. And then once I realized like how big of a difference that really makes, I was like, wow, they weren't lying in school with how important this is, you know. I went back to school and got certified in ergonomics and just started my business. And my goal was really to help dental professionals because it seems like most of us struggle with that.
Absolutely. I taught pre-clinic, which is where you teach ergonomics, right? I know the importance of it. And I remember like learning about it in school, but it did not stop me from just acting a fool once I got
Oh,
out and
yeah.
graduated. Like I hurt myself so quick. I mean, I have flare in the arm, I have shoulder pain. I'm like just now working on resolving the shoulder pain after, 11 years. And part of it was because some other things come up. We shared, I was on your podcast. We talked about my endometriosis diagnosis, all the things I've dealt with there. So the shoulder kind of took a back burner. But
Yeah.
after I got all that kind of fixed up, I was like, wow, now I'm realizing the shoulder is a problem, right? And that was chronic from flaring my arm for years, but it's ongoing because it was like I would go to work, I would drive an hour, my shoulders were up, I would work all day long, then I'd drive home. So it was like my shoulders were literally never down, I think.
Yeah.
And, so yeah, that pain that you feel in me, it's real and it can happen so fast. And it kind of drives me crazy because so many people call dental hygiene the 10-year career. And I
Mhm.
just think we know what the problem is, like if pain is the problem, we've got to start fixing it sooner. Is that kind of your mentality?
Yeah, and I'm the same as you. I mean, I wasn't always ergonomic. I did not give 2 seconds thought to ergonomics for the first decade of my career, you know? But I could kinda get away with it back then, right? I was young. I was relatively healthy at the time. I didn't have any issues, but I do think that pain, has become normalized in dental clinicians. Everyone complains about it. Just because it's common doesn't mean it's normal. It's never normal to be in pain. And yes, I think a lot of the things that we suffer from, like rotator cuff problems, carpal tunnel, tendonitis, low back issues, hip issues, they are preventable. But we have to be much better with like prioritizing ourselves during the appointment. It's not all about the patient. I know that's hard for us to wrap our head around, and really be strict with ourselves when it comes to ergonomics. But I'm talking more now. I mean, yes, the posture and ergonomics is huge, but it's everything else too, Dana. Like we've talked about, like exercise, diet, sleep, mental health. It all plays into our overall wellness. And we just have to think about ourselves as like an entire person and think about our 80-year-old self now, because what we're doing now is going to dictate how we feel in our 80s and 90s. So,
Yeah, and I love what you said that pain is not normal, but for some reason we have normalized it. I mean, I think
yeah.
this even goes beyond just dental hygiene. I know so many people are like, yeah, this is bothering me. I'm like, well, do something about it, right?
Right.
Like, we
Yeah.
got to make changes. And that was one thing I recorded a little episode recently about basically what I kind of wish I had done differently after I graduated. And one was just a daily check in. Like, really, where am I at in my life and how am I feeling? Like, am I living my best life? And I think had I started asking those questions a little earlier, I probably would have made adjustments sooner instead of just powering through, like you said, putting the patient ahead of yourself. And we just really can't live like that. I don't want dental hygiene to be a 10-year career for
Mhm.
most people, and I don't think it should be. Well, you mentioned that you went back to school, got certified in ergonomics. So I just have to know, like, where do you go for that? What does that look like?
Yeah. So at the time it was over COVID. So there's still like schools weren't open. So it was a virtual training, virtual certification. And sometimes people call me an ergonomist. I am not an ergonomist. That's someone who's gone to school for like 4+ years with ergonomics. That's not me. I'm an ergonomic assessment specialist. So what I'm able to do is observe people either at like office workers or in the dental workspace and assess what they're doing, identify their risk factors, and give them some guidance on how to practice better. So I just want to make that clear. But yeah, it was through a school called the Back School. They do multiple certifications, they do in person or virtual. But the thing is with dental, there isn't, not yet anyway, there isn't a dental specific ergonomics specialist training. I'm sure someone will come up with that at some point, but what I had to do is I went to the back school, got certified. So I was able to assess like office workers or people in a warehouse or people on a assembly line, you know? And when we're talking about ergonomics, All the principles are the same. Maybe as far as posture or like the chicken wing, maybe the environment changes, but the principles are the same. So then I started assessing or going into offices that would let me watch dentists and assistants and hygienists and learn what the struggles each of them had and kind of translate that into the training that I had gotten. And then that's what helped me develop my program.
Yeah, that's amazing. Yeah, so now, you're helping people with ergonomics, you're speaking. Are you still practicing clinically?
It's very like on a fill-in basis. It's becoming harder and harder just with everything. Sometimes I feel like I'm being pulled in a million different directions. And something that has humbled me with this is just realizing I cannot do everything all of the time for everyone. So it was a slow progression dropping clinical days over the past 5 years. Now I get in when I can, but it's becoming harder and harder.
Yeah, I get that because I'm about to drop my one clinical day
Oh,
at
yeah.
the end of
Yeah.
this school year. Yeah, and I'm like, "Oh, I'm scared," but I know that's what I have to do to stay in alignment with where I need to be going and where I need to be putting my focus, and it's hard. So, I'll be doing the same, mainly volunteer, fill-in basis, which I'm okay with, but yeah, it's just you have to follow your passions and follow I think your skills and talents, which are obviously in what you're doing now. So I'm just curious, what does a day or maybe a week in your life look like as I'm going to call you now a non-traditional dental hygienist, right?
Yeah, so it's honestly, it's all over the place. Every day is different, which is fun. It keeps it interesting. But because I've got my hands in so many different things, so some days I'm building a slide deck, whether that's for me, an upcoming lecture, or I do a lot of content for other companies. So it just depends on that. Maybe I'm recording a podcast. Maybe I am shooting some social media videos or editing those videos. It's not just shooting the video, it's the editing that takes forever. So I know that you know that. I have an online store. Sometimes it's managing that, shipping things out or processing orders. I mean, emails always emails. Yeah. So I'm not super organized. That's actually something that's getting pretty bad. So I don't have my days structured like with blocks or anything like that. But I do have my to-do list of like, 5 to 7 things that I'm trying to check off during the day. But it's interesting. I went through this kind of identity crisis when I really stepped back from clinical and was like, I can only do this on a fill-in thing. I'm like, I don't even know who I am anymore. Like if someone asks me what I do, I don't even know what to say. I don't know what to tell them. So that was kind of hard. But also all of the stuff that I'm doing right now, there's no instant gratification. It's not like clinical where you like are I don't know, scaling teeth, you're getting that stuff off, you're dismissing your patient, you're done with the date, you come home and you're done. It's not like that. All this stuff is very long term and I don't get the payoff for like months. These projects just take forever. So it's just been a big, I don't know, mindset shift, I guess.
I don't know if I asked that question selfishly because that's how I feel right now.
Yeah, I was
I'm
going to ask how you're doing because it's a thing.
Yeah,
Yeah.
it is. Identity crisis is probably the best way to describe my last year where I'm like, what am I doing? And I have a
Yeah.
business coach now and I talk to her, I'm like, I don't even know. If people ask me what I do every day, I don't know what I do every day. I know I do a lot. I know I'm working every day, but what am I doing
Yeah.
it? And it feels that way. I think you described it so well. I mean, so I say this for anyone because I know that there are people out there who may want to become a business owner, entrepreneur, branch out, try something different. And there is a lot of unknown. And when you do that, again, it forces some introspection. And I feel the same way. I'm still learning like how to schedule. I feel like a baby again.
Yeah.
Like before, if you think about when you're growing up, you go to school, you have a set schedule, right? Like every day, I got to wake up at this time, I got to do this, I got to do that. And you just follow the motion. Like your whole life is what you're being told to do. And in clinical, the same thing. Okay, patient at 8, patient at 9. And you don't have to make that many decisions on a daily basis. But when you suddenly have full reign of like your schedule and like what's happening each day, it's overwhelming. Like it's
It
insanely
is.
overwhelming. Yeah. So I mean, I feel the same way. I'm like, am I organized? I don't know. Maybe, maybe not. I'm not sure what I'm doing at any given time, but I know I'm just pushing forward and things are getting done. So I guess it's all working out, right?
Yeah, and it's just something too is like I'm used to, well, I'm not used to anymore, but I have a task and I would complete it. I check it off my list and check off the next one. Now it's like, okay, I got a little bit done on that, but I can't check it off yet. And I got a little bit done on this, but I can't check it off yet. So it's like I don't have that same it's just not the same mentality. And it's the same with money too. And that was another thing is like when you're an entrepreneur or start your own business, We have to get out of that mentality of getting paid every 2 weeks or getting paid by the hour. It's not like that anymore. I mean, sometimes you'll go, a month without getting paid, and then you make a bunch over the next couple, like, it's just different. And that takes time too. We're all just learning. I didn't have any business training at all. So it's just like trial and error and figuring it out, but it's definitely way different than clinical.
Yeah, it is, and such a good point because you add that financial stress, and I mean, your to-do list could be 12 miles long,
Yeah.
That's what I'm trying to work on now is like, okay, prioritize. And I realize I'm the same. If I tell myself, okay, you just have to work on this for at least 20 minutes. So that I get in
Yeah.
there, I'm like, okay, I did it. And that's my check off for the day. I'm like, I worked on it for 20 minutes. Okay, that's a little step further. But it's such a challenge, and I think as hygienists, a lot of times when I'm having these conversations, we don't really go into what life looks like when you literally take a completely different avenue than maybe what's been laid out for you, and what you've been envisioning. I did not envision this for myself at all. Did you at all
No.
when you yeah.
No. I thought I was gonna be a hygienist till I retired,
Me too.
seriously.
Me
Yeah.
too. Yeah. Until I found out about like education, then I thought, oh, that's cool. And then I
Mm.
thought, I'm going to be in formal education until I die. Like, that's really what I thought was going to happen. And life just has its way of, I don't know. It's fun. It's fun to follow your paths and your interests and see where it takes you. I like this random conversation. This was not the questions I had outlined. Sometimes you just got to go where I'm following life right now, right?
Yeah.
Well, I think the last question I would love to ask is, envision yourself past Stephanie on this journey to becoming a dental hygienist. What advice would you have given to yourself back then?
Being open to everything. I think I used to be a type A. I guess in some ways I still am sometimes, but type A control freak. If things aren't going my way exactly how I envision it, either I'm failing or people around me are failing or something's wrong. Being open to where life takes you, or like this conversation where it's taken us, right? Being open and just kind of going with it. I don't want to sound too like woo woo, but things come to you when they're supposed to and in the way they're supposed to. And don't miss these opportunities that can come and literally change your life because you're so stuck in some preconception of what you think your life should be, right? My
Yes.
business has not gone the way I thought, but I couldn't have even imagined this. So yeah, just being open and just letting go of things and not holding on so tightly to what you think is right.
Yes, and that starts even when you're applying to dental hygiene school because you think, I know for me, I was like, I need to get in this year and I need to start. And then what happens? You don't get in.
Yep.
You're like, what now? And life has a way of, I think, humbling you and forcing you to do things at the time that's right for you. And I don't think that's too woo woo. I think that that's right on track. So I love that advice. Well, thank you so much for being here. I would love students to come find you, listen to your podcast. So go ahead, shamelessly promote, tell them where they can find you.
Sure. Yeah. So I guess the central hub where everything is my website. It's polishposture.net. My social media, I'm most active on Instagram. I'm steph.polishposture. And then my podcast is straight up with Steph, but it's all linked there on my website. And thank you so much for having me, Dana. I always enjoy talking to you.
Absolutely. I appreciate it. Yeah. And definitely, I'm going to just like double plug your podcast because it is like one of my favorites. I'm like 2 episodes behind right now. And I'm like, I feel not normal that I
Oh my
don't.
gosh.
Yeah.
Thank you so much.
Yes, it's just incredible. I love your content. It's just different. It's different than anything that I usually listen to, and I find it very refreshing. So you're doing a great job. I'm going to give you your podcast kudos today.
Oh my gosh. Thank
Yeah.
you.
Of course. Thank you so much for being here.
Thank you.